Alberto, 28 years old, came to the clinic because cluster headaches, which are kind of very intense ones. He'd been suffering them at the age of 12, and 7 years before our meeting, after cannabis intake, they were reactivated. It was also common that sudden changes in climate were preceded by his headaches. The pain, pulsating, was felt as right hemicranial pressure, especially in the eye, and was relieved by local pressure and the application of cold. The headaches were usually accompanied by a feeling of internal discomfort and tearing, and followed by dizziness, nausea, and vomiting, together with sweating and hot flushes. Obviously, after the attacks, he was exhausted. Alberto was an imaginative man, interested in the arts and music. To my question, he admitted being rather messy. His childhood had been satisfactory, with no particular traumas. In my opinion, he had traits of what we, acupuncturists, called a hyperactivity of the Hun, which is the liver Benshen, that is, its organ spiritual facet. Despite apparently not having any childhood traumas or later ones, due to the chronicity of his headaches and in the absence of any criteria allowing me to diagnose any junk food disorder, I deduced that I was dealing with a primary Yang Wei-Mai disorder. At the time I was treating Alberto, in 2009, I was unaware of the existence of the extraordinary meridian's creative points. So in his case, I stimulated directly Sanjiao 5, which is Yang Wei's key point. It went well enough, although on 2 occasions I needled it together with Dumai 17, which is a point that treats mixed headaches, that is, those though appearing in the same person are completely different among them. Well, within 6 sessions of Sanjiao 5 Waiguan puncture, his migraines were resolved. I had the opportunity to see him 3 months later, and he was still headache-free. In this case, we'll never be able to know if gallbladder 35, which is Yang Wei's creative point, would have worked as well. In his particular case, I think that his liking for arts and music revealed a fire typology, which, among others, resonates on the Sanjiao meridian, where Waiguan, Sanjiao 5, is located. So it is likely that, even today, I would have tried this point as well. Perhaps the only difference is that, in one of the other sessions, I might have also tried gallbladder 35, Yang Wei's creative point. Carla was a 17-year-old teenager, although she had a childish appearance. By the time I saw her, she had missed school for 4 months because of painful headaches. She was prescribed antidepressants in an attempt to smoothen them. The pain used to appear in the evening night and was located in the Shaoyang area. The throbbing sensation was relieved by local pressure, rest, and darkness. The analysis of the 8 rules allows us to deduce that it was a local yin void, blood in this case, which subsequent stagnation explained that the pain was stabbing. I'm not going to explain now exhaustively all the details of her medical history, because this would lead us to rather complicated technical analysis. On the other hand, it is of interest to point out that she also had laterocervical pain and that her menstrual cycles were long, even with periods of amenorrhea. On a psychological level, her childhood had been satisfactory, but she changed schools the previous year and was not at all at ease in her new environment. When I first met, I found her touchy and irritable. I began treating her through what we acupuncturists call the Zhangfu organ and viscera treatment. But after 7 sessions, nothing had improved. Finally, considering the possibility of yang wei mai disturbance, I punctured gallbladder 35, its creative point. There was some improvement, but little. Therefore, in a new attempt, I chose to needle gallbladder 13. This acupoint also belongs to the yang wei meridian and, according to Giovanni Maciocia, beyond attracting jing to the head, it has important psychic actions as well. Although among its clinical indications, headache is hardly mentioned for gallbladder 13, I chose it because some French authors claim that its location on the border of the scalp, that is, on the border between the invisible and the visible, is symbolically connected to the process of externalization of emotions or linking the individual with the outside world. In Carla's case, it seemed to me that in a context of yang wei meridian, to which this point belongs, that was seemingly her conflict. Well, the needling of gallbladder 13 not only resolved her headaches, but its puncture seemed to provoke an important psychic change upon her. The following week, I found her with a radical new haircut. As a result of the stimulation, her menses came back, and from then on, her cycles became normal. Let's not forget that yang wei, like any kind of yang qi, mobilizes yin. In this case, it was a shui yin, which was set in motion, both in the head and in the pelvis. Her GP could withdraw the antidepressants he had prescribed to her. What prompted me to think of a yang wei mai disturbance in Carla's case in the absence of signs of weather sensitivity? Well, although Carla's irritability might have been attributed to a liver qi congestion, which she certainly had, and the reason why I started addressing her zhangfu imbalances at the beginning. In this case, she was irritable in response to the distasteful environment she found at the new school. Despite the poor school rudeness, I ruled out a Chiao Mai pathology because she had no criteria for such diagnosis, no plantar alterations, no lower limb dysmetria, no unilateral pains, no insomnia. The pulses did not point to this possibility either. It is true that her headaches tended to begin in yin periods, at night, but a yin stagnation justifies a nocturnal predominance of a pain, and, as we have pointed out, the yang of yang wei mai is capable of mobilizing the various inner yin affected. In the end, this case was solved after several attempts. In fact, so many that it was not until we approached session 20-21 that I found the target acupoint. And I explain this so that you don't think when I present clinical cases that I always get it right the first time. Not at all. But it is also nice to see how, with a single acupoint, what has resisted other approaches can be solved. I dedicate this comment to my colleagues to encourage them to have confidence in the capacity of acupuncture. I believe that our job is to study, to think, and test in an orderly way. Unfortunately, we're not seers. Therefore, when faced with a patient, we must have the rigor and calm to stop and consider the possible diagnosis. If I was to make an analogy with a closed door, I should say that in order to be able to open it, we should begin by analyzing the locks model and then take into consideration the keys we have to open it. Most often there are several of them, but only by systematically trying them one after another in a reasoned way, you do have a chance of finding the right key to open it. And sometimes you may fail because we still don't know all the acupoints in depth and because we're miles away from knowing everything. But I explain these cases to show that, at least, it's worth trying.